Podcast.
Bring your friends!
Yes!
Somebody's excited.
Yeah, I can tell.
The return of the boss man, the legend, the homie,
The myth.
Gustavo Negrete.
Awesome. Thanks for having me, guys.
Yeah, they tell stories about you around campfires.
Oh, shit. I guarantee. Okay, so apparently I'm still a legend at a few hospitals. I'll have to share stories later on with you guys.
Oh, nice.
Yeah,
Dude. So for the people who don't know, first of all, thank you for following us. Go ahead and hit the like and the subscribe button.
Mm-hmm.
For the people who don't know, Gustavo Negrete is not only my mentor, my friend, and a very good homie to us. He's a returning guest. He was here about a year ago. He had just left the NBCMI or CCHI board.
that's right. Yeah, the NBCMI.
Yep. Yeah.
NBCM National Board of Certified Medical Interpreters. He was the president for a while. So for the interpreters who are going to be hearing this, now you know who.
Well, now he's the president of the.
Now you are the president of
APTI. Yep, the American Alliance of Professional Translators and Interpreters.
Okay.
Which everybody should join.
I'm joining it. I don't even know Spanish, so.
You don't. It doesn't have to be
Habla Deutsch.
Spanish.
Habla Portugués.
Você fala português?
Yeah.
Muito bueno.
I know a little French, so.
You did live in those countries, though.
Yeah, I did.
So that's why. Yeah.
Yeah. I pick up words here and there, so.
So the people that don't know, this is the boss man. If you want to know more about him, you simply can go over to his Facebook page and you'll talk to him. If you want to learn more about what is it that the boss man and I do, go to transinterpreting.com and go ahead and subscribe for some classes.
You also can go straight to OPTI, right?
You can also go to opti.com, correct?
Yes, sir. That's right.
Yep.
Okay.
It's
So,
opti.org. Opti.org. Yeah.
Opti.org. I apologize.
Oh, .org. Okay.
All good.
Subscribe.
All
Join Opti. Just join Opti. You won't regret it. We have really good end of the year events. This year we had a powerhouse of like you had the Avengers team for
pretty much.
Talk about that?
Yeah, actually, we're just fresh off the heels of our annual conference, and I gotta tell you, man, we got some overwhelmingly positive, electric, enthusiastic feedback about the conference.
Oh, good.
Literally, we literally got the who's who, A-listers in interpreting and translation. Everyone walked away happy. Everyone walked away just ecstatic, waiting for the next one. The one negative thing that we got back was that people wanted to sign up last minute. People wanted to come in. We literally had people literally line up at the door and said, "Here, I'll PayPal you, I'll Zelle you, I'll pay you with my credit card. Just take it, so I can come in because I want to join. I want in."
Oh, nice. That was that was California, though, right?
Yes, sir. We were in California. Yeah, right. We were at Cal Poly Pomona. On
the college campus, right?
Yes, sir. That was right.
Oh, nice. There they are. Yep.
That was
the
powerhouse.
Them. That's the powerhouse right there. Yep. Everyone, dude, there was not even amongst the seats of all the attendees, there was not an empty seat at all. We stretched it to the max. We fit in as many people as we could.
Hold on, Hefe. You cut off there. Go ahead and start again.
Sorry. Oh, sorry. What I was saying is that even like we had to open up more space for people to come in. We literally try to work with the college, with the university, just to get more people in. And luckily, they worked with us. Thank God, because we were able to get a bunch of additional people in. There was not an empty seat, and even then, they had to pull out more chairs just to fit everybody in.
I think between all those people, to include yourself, there's over 130 years of experience combined, right?
That's 100%.
Give or take, yeah, probably a little more.
Now you went to this one, and you usually have a theme when you do your conference, right?
Yes, sir. This time it was. Pardon me if I don't get the title right. We're a little bit away removed from it, but either way, it was. I believe, if I'm not mistaken, the theme of the conference was advocacy, AI, and evolution, the future of T&I. And we brought in those A-listers. We brought in essentially the linguistic Avengers, and just blew the roof off of Cal Poly, man.
For the people who are listening that probably don't understand much about what we're talking about, because I know this is a very specific episode, can you explain in medical terms what advocacy means, please?
Sure. So advocacy in any sense of the word is essentially an action that is done to promote a specific cause. That's essentially what advocacy is. So for those interpreters whose ethical principles include advocacy in there, that's, in a nutshell, that's what advocacy is. You're departing from the traditional role. You're not converting, you're not clarifying, you're not brokering. Now you're actually taking further action, and you're actually, pardon to be redundant, but you're advocating for a specific thing, whatever it is that you're advocating for.
So like, we'll say workman's comp.
Sure. So
Okay.
in work comp, and then even then with advocacy, there's a time and a place. That's one of the things that a lot of interpreters kind of they miss the point of advocacy sometimes, and they kind of throw it in just cavalierly or just casually, haphazardly. And
we'll cover that. We'll cover specifics.
Yeah, we'll cover a little bit more. We'll talk a little more about it, but essentially, work comp would probably be one of those areas that's not a go. The injured worker, they have their lawyer, that is their advocate.
Okay, because I was curious, because you're talking about AI, and maybe I don't understand, but artificial intelligence doesn't seem like it is a threat to linguistics. Because
you just jumped right into it.
Hey, it's all good, man.
You brought it up. You said AI.
Well, yeah, it was baked into the title, so yeah, it begs the question. So
yeah, it's right in the title. Maybe I don't understand it because it doesn't. Because you can know Spanish. Like I knew a guy, he understood Italian, didn't speak it, but he understood it.
Right.
And there's another guy who spoke only Spanish. He was in Spain, understood the Spanish in Spain, but he couldn't help us in Mexico. So,
right.
I mean, he figured it out. But I'm just saying there was a content which he was unfamiliar with when from the two different places. And I don't understand how you can understand a language and not be able to speak it.
That's a good question.
Well, there's all sorts of reasons that would actually happen. A lot of them have to do with, a lot of it has to, any example I give you is pretty much anecdotal. So, for example, I say I moved to France. Okay. I know a little bit of French, not too much, mostly the curse words and how to order. That's pretty much it.
Okay. Yeah.
But I moved to France, right? I'll start learning some, I'll start picking up, but the farthest I'll probably get would probably be conversational level, right? And that's very dependent on the person, if they have an ear for language, if they're able to pick it up, if they're able to pick up on nuance, and it mostly has to do with just essentially exposure. It has to do with capacity. It has to do with a little bit. There's all sorts of stuff that goes on with it. You know what I mean?
Okay, because I was just curious because, like, I can say amigo,
right?
But I say amigo, but I can say amigo. That's two different. I mean, it's the same word, but
Well,
it's
All
not.
right.
I didn't. It's not the same.
Oh yeah, no, context is king here in that case, you know. Yeah. You know.
And I'm just wondering, the AI is not able to determine which that subtle difference.
Right. And
Am
even
I, am I
then,
not? Am I wrong or?
no, you're right. And in fact, that's one of the reasons why we well, in interpreting and translation, AI is still a hot button issue. You know, it's a bit of a boogeyman in interpreting and translation. Um, AI is forever changing. I don't think there's ever going to be a final version of it, and so that's really the kind of the scary part for a lot of interpreters and translators. But truth be told, what's scarier to me, rather than the AI itself, is the essentially haphazard, indiscriminate use of it. So non-interpreters, non-translators using it as quote unquote a means to an end for language
Mhm.
services, but not really knowing what the heck they're doing with it at all. Um, and so really truthfully, that to me is actually the scarier part. Someone just using it to check a box and say, oh no, we had an interpreter. It happened to be AI. And you know, the final product is mediocre and it doesn't really serve the purpose at all.
part of the issue with that also is, and I know you are also a HIPAA privacy security expert, correct? Am I
That
correct in
is
that?
correct. That's
Can
that's
you
100%.
can you explain? Because I have a hard time when I tell people that. Can you explain what that entails and what that means, please?
Sure. So I, as a HIPAA privacy and security expert, I essentially, you know, through training, through credentialing, I learned essentially the ins and outs of HIPAA when it comes to, you know, protecting, you know, the protected information of anyone and just about any situation. And it's not just related to healthcare either. A lot of people let's say, sorry, a lot of people hear HIPAA and they say, oh, doctor's office, hospital, etc. HIPAA extends way beyond that. As a matter of fact, I think I
Okay.
mentioned it on the podcast the last time, is that HIPAA actually, or sorry, the FTC adopted a lot of the same functions of HIPAA and incorporated into financial transactions. A lot of people don't know that.
Okay. No, I didn't know that
Can you
either.
elaborate on that?
Sure. So, for example, any information that's associated with an individual's account, whatever that account is protected information, right?
Is that part of
So,
the
Yeah.
21? I'm sorry, I hate to cut you off, but I have a question here. Is that
yeah.
part of the? Is it 19 or 21 key pieces of information like name,
Oh,
date of birth,
it's 18.
18?
It's eight. Yeah, yeah. So it's part of the what I refer to as the 18 national identifiers. Essentially, is what it is. So the obvious ones: names, dates of birth, socials, you know, or social security numbers, emails, bank account information, insurance information, all that other jazz. That's the usual stuff, right? But what a lot of people don't understand is that baked into that is also, for example, I'm on a computer right now. It has an IP address, right? So the
Okay.
IP address is also protected.
Okay.
Yep.
But wouldn't that fall under like Privacy Act, privacy statements, or anything like that? Because doesn't that
No,
cover
it
not in
does.
financial?
It kind of does, but it doesn't at the same time because it's not so much. So, for example, I buy something from Amazon. They have a privacy statement on there, right?
Yeah.
Every time you do a transaction, you get it, and that's just because they're essentially telling you that, you know, this transaction, because XYZ information is being used to create this transaction, they're protecting it, right?
Yeah.
That's essentially what the privacy statement does. Okay. But on the back end of that, it also has to do with how they store it, where they store it, who has access to it, who can who can access it, and everything else, same as individually identifiable information at a doctor's office. So
Okay,
yeah,
so it has a lot to do with security then.
oh yeah.
Can you explain to people, because this is a very common question that I get, and for the
Shoot.
people that don't know what we're talking about, we're talking about like the information in which you can easily be found in or identified, such as, and correct me if I'm wrong, because this is part of the Transinterpreting 60-hour medical course, which if you haven't taken it, you should. Phone number, right?
Yep.
Address.
Yep.
Among other things. Why is it that, because what people don't understand too, which I learned this with you, is people violate HIPAA more often than they more often than what they think.
Right, exactly.
What are some ways? I don't want to ask this. What are some of the most common violations that people do that they don't realize that they're doing?
Oh, the biggest one, and this ties into AI specifically,
Oh,
is that
we're gonna go.
he says that they feed in information into open source AI software. That's one of the biggest.
Say that again. Say that again, because I'm clipping this. No, I'm not laughing, bro. This is it. First, go ahead,
Yeah,
because Google translates the same thing. Go ahead, I'm clipping this.
Right, exactly. So one of the most frequent violations that people commit without even knowing that they're doing it is that they feed protected information into AI, and AI, as it stands right now, is all open source.
Oh, so none of it's protected. Yeah, none of AI is protected.
No, even if someone claims that, oh no, our AI is HIPAA compliant, that doesn't exist.
Okay, so
Not
Google
as it
Translate's not
stands
protected
right now. No, Google Translate is not protected.
Can you elaborate on Google Translate? Because he's asked me this before. That's why he's sitting there like,
Right.
okay, explain this.
Yeah. Okay. So the way that Google Translate works, okay, without over explaining it, without over complicating an explanation, is that it takes information, right, that it's being fed, and it houses this information, right, at Google, right?
Yeah.
And then when you're running a query, let's say specifically Google Translate, right? It also has taken information that someone else in that specific language has also fed into it. Okay. But everyone's able to access the same information. Okay.
Okay.
So as I feed in information into it, however raw the information is, right? When it spits something out, it's because it's compiling the information that it has taken in and producing something, okay, by based on whatever command I gave it. Okay. So if I'm telling it to translate for me, Miss Rodriguez has a follow-up appointment on et cetera, et cetera, et cetera. All of that is actually, believe it or not, protected as well.
Okay.
So even if it's just appointment information, it's all protected. Why? Because it has to do with that one specific individual. Okay.
So there's no roadblocks at all with AI yet.
No, not really. Not yet. Not as it stands.
Okay.
To my knowledge, as far as I know, there isn't.
Can you explain to people what the difference between PHI and the connection between PHI, HIPAA, and AI, and what the danger is there,
and what
Sure.
PHI is,
and what
So, sure, of course.
I'm so sorry.
Of course, yeah.
It's I'm sorry. Thank you. Go ahead.
It's all
Because
good.
I'm clipping this. Eric's like, what the fuck did you call me?
So PHI is simply stated just protected health information. That's what it is, right? So
Okay.
when it's in an electronic media, then it just turns into EPHI. That's all it is. So it's electronic protected health information.
Wait, say that again.
It's protected.
So when you have PHI, right, protected health information, and you have it in digital format, right? Or electronic format, however you choose to call it, then it's just labeled as EPHI, right? Just because it's electronic. That's all it is. Okay.
Oh,
Okay.
Okay.
And so that's pretty much the umbrella term that everyone uses. It's just PHI, right? Now, if you filter that information down, right, and we get into those 18 identifiers, right, then that becomes individually identifiable information. Now, if it's health related, then it's IIHI, right? Because then we add that health part, that health component to it. So it's individually identifiable health information. If it's not specifically health related, it's still individually identifiable information. And that's covered by HIPAA. It's also covered by, again, what I mentioned earlier, the FTC and any sort of transactions that use that information, right? And specifically when it comes to how that's linked to AI specifically, is that AI, again, as it stands, okay, it's the way that the AI stores information is just stores information in data centers. It's up in the cloud, it's in a server, right? There's no, it's anyone can access the cloud while I use the same AI.
Okay.
Could you give examples of hold on, because I know you're going to ask this in a minute. Could you give examples of the difference between PHI and I oh God, my brain, and individual personal information?
Sure. So PHI, again, umbrella term, protected health information, right? If I start including into that PHI specifically, if I start saying your name, date of birth, social, medical record number, phone number, address, IP address.
Your medical record number is in there?
Yeah, medical record number too.
Oh,
why?
okay.
That's generated. That can be reused though, right?
No. Medical record numbers are individual.
Oh,
now,
okay.
If I have, okay, let's just say Richard, right? Richard goes to, a chain, right? Accelerated urgent care, right?
Yeah. Which is
So
which here we call them what are they called here for VA? The short-term like emergency, short-term emergency.
Yeah, it's shit. You'd have to ask me that. I can't remember now.
You just did one. But yeah.
Okay. So anyways, let's just say Richard goes to accelerated urgent care, right? So on that visit, right? Let's say it's your very first visit, right? They have you fill out all your information, right? Contact info, name, et cetera, right? That moment right there, a medical record number is created. Okay. If for any reason you have to go back, right? Just because it just so happens to be easier, your medical record number stays the same. The only thing that changes is the visit number.
Okay, so like follow up.
Yeah. So if I go in because I have, ear infection, right? And it doesn't seem to be getting any better. I go back to the same urgent care. It's the same medical record number every single time. There's no change. The only thing that changes is the visit number.
Okay.
That's it. So your medical record number follows you whenever you go visit the same provider every time.
Does it change? But it changes from hospital to hospital, because if I go to
from
one
hospital to hospital, yes.
Okay.
The exception to that
my confusion was, I apologize.
Yeah. So yeah, if I go to hospital X and then I go to hospital Y a month later, two separate hospitals, they have nothing to do with each other. They're going to generate their own medical record numbers. Okay. But in any sense,
works with
both medical record numbers, now that they both exist, they're both protected either way.
Okay. And that works if you change doctors too. So your number changes again.
Right.
Okay. So any change, it generates another number.
Right.
Okay.
I know you have a question. Sorry.
Well, I don't know if you've seen this, but they had the AI companion.
Mm-hmm.
What? I haven't finished your question yet.
He already knows where you're going.
Hold on, Jefe. Hold on. Go ahead. No. Go ahead. I want to hear this.
They've been advertising. You've probably seen them. AI companion.
Mm-hmm.
How is that different from whenever you're using it as a AI as a tool like ChatGPT?
Oh, okay. That is not where I thought you were going with this. I'm so sorry. I apologize. I owe you an apology.
Okay,
Okay,
so
that's a good question.
okay, so what's the difference? Is one is being used conversationally, the other one is being used. I mean, depending on how you're using it, right? Um, the other again, really sorry. It just depends on how you're using it, really. So let's just
Okay,
say
because you can
I'm
ask them both
somewhere.
the same question, is what I'm saying, and it should generate the same
Yeah,
answer.
but one's gonna jerk me off.
They can do that? I don't think we had that technology yet.
I gotta laugh out of him. That's all I just wanted to laugh. That's all I wanted. Go ahead, Gustavo. Sorry.
Yeah. Well, now I lost the question. So the
Well,
question
you can
was
ask
again.
ChatGPT a question, and you can ask an AI companion the same question. It should generate the same answer, right?
It might not. It depends on what information has been fed.
Oh,
I
because
see.
the AI companions are normally for, and all joking aside, AI companions are normally for sexual stuff. You know, like group, right? The group, is that right, Eric? Is that the
I
Elon
think
Musk one?
I think so. Yeah.
Yeah, and then you have like you see them on Facebook all the time. How is that not? So I get where you're going. Let me see if I can rephrase this.
Okay.
How is it that one AI it's cool to put information in it because it's like for self-pleasuring purposes or other purposes, but then this AI doesn't. Like that would be the question I think he's trying to ask.
Okay. So if
I get
there's
it.
the biggest difference is what's the intended use. I guess that's the biggest question, really.
Okay.
Okay.
All
So
right.
if I'm using AI for, again, as you delicately described it,
Yeah.
for self
Yeah.
use, right? For self use and self abuse,
I got it right
then that's your business. You know what I mean?
Okay.
Well, I was just thinking that they
But
run
if I'm
on.
using it for professional reasons,
Uh-huh.
then that's a whole that's again that's kind of the whole reason. Sorry, that's the biggest reason why interpreters, more specifically, and translators are not necessarily AI phobic. It's just that we're specifically wanting guardrails.
But here's the thing with that, right? And
Mhm.
this is a conversation that I know you've told people that I've said, and people have messaged you about me saying this, is it's still a fucking hip privacy violation.
Oh yeah, no, it is.
So then my point is, and this has been my point, I said it last year, and a lot of people, especially big people in the industry,
Yeah, they didn't like. Yeah, they didn't like that.
Yeah, they didn't like that.
No.
So my whole point is, how is it that people don't see? Because okay, I had this conversation with a client today, right?
Right.
And I'm not gonna mention the client, protect,
Yeah.
and they were like, hey, what if I put this information to translate on an AI? And my argument was, are you putting the client's information? They're like, well, yeah, I'm just downloading their sheet. And I'm like, that is a HIPAA violation.
There you go. There's the violation.
So it's very clear and
because it's open source.
Use my language. It's very clear and fucking precise that it's like,
right.
If I grab, court, let's talk legal, right?
Let's go.
If I grab a document, okay, and there's protected information in that document, right? If I grab a deposition, and in that deposition there's a case number, that case number is an identifying mark, and I grab that person's information, and then I grab what's also in a case log or in a deposition, the person's name, address, date of birth, like you put that into AI. I don't think that's HIPAA, but I know for a fact that's a privacy violation.
Oh yeah, it is a privacy violation.
So why the fuck do we have interpreters that should know this? Because we all have to take a privacy class, we all have to take an ethics class, we all have to take a fucking HIPAA class. They're putting that in there, and they're like, oh yeah, this is what I use, and it's fucking simple. Like that's what I can't wrap my head around, that people are that I don't want to say stupid, I don't want to say what I really want to say.
Uneducated.
No, it's not lack of education.
It's willful ignorance.
Well,
No,
I didn't realize that all AI was open source. Is all I'm saying.
Oh, dude, yeah. Go ahead, Hifit.
Yeah, it's willful ignorance is what it is.
Willful. What do you mean by? Can you elaborate on that? I'm sorry.
It's
Have you seen
willful
a Marine?
ignorance and willful neglect. I shouldn't laugh. I have cousins that are Marines.
God damn it, Eric. That's one. What do you mean by willful ignorance? Like they just
Okay. Okay, so like you said, we all take ethics classes, right?
Mhm.
yeah. 9
So you
hours
should
of
use
it
it.
every year.
Yeah.
Right. So you should use your noggin, right? You should use your critical thinking, and you should know that hey,
Mhm.
there's some information that I could use to get a quicker draft on a translation, right? And then there's other information that I should definitely not be putting in there because again, this is all, open source. It's all open information, right? Anyone can access the information, right?
Yeah.
So that's where the violation really is if you're inputting information that's not supposed to be publicly disclosed or fed into something that doesn't have secure infrastructure that someone else is going to be able to access it by other means, right?
Mhm.
That's where the violation comes in. In healthcare specifically, there's specifically in HIPAA, right? There is what's referred to as there's what's referred to as holy shit, why am I blanking out on it? I'm a freaking expert in this.
Put him on the fucking spot.
Yeah, just doing.
You just need a drink here. Let me-
There.
Yeah, no
There.
shit. I
Line
probably
right
need one
there.
of those.
Ask ChatGPT.
That's Chad, right? Hey, Chad, what is this thing I'm supposed to be trying to remember? Right?
Group, okay, group, yeah,
group. Is it? I'll Google that. Go ahead. I'm sorry.
I'll do DeepSeek. Sorry. So where you could potentially put something in, that's if it's referred to as de-identified information, right? And there's only two ways to actually de-identify information according to HIPAA. Okay? So there's the expert method, right?
Uh-huh.
That's number one.
Uh-huh.
And then number two, which is oftentimes referred to as the statistical method. Okay, so those are the only two ways to actually de-identify information. So, for example, when people do case studies, right, they change the name. They don't have any other identifiable information included in there, right?
Like FDA studies.
Right, exactly. Clinical studies, case studies, stuff like that. So they'll call them Mr. X or Mr. Y or whatever the case is, right?
Mhm.
But they'll have all of the other details in there, right? Not necessarily any of the other information, but what the clinical trial was, what the drug was that they were using, what they're in a placebo for, so on and so forth, blah, 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 right? So that all that stuff is eventually does get published, but because they de-identified it and said it and changed names, omitted specific information that would be identifiable to that person, it's okay.
Okay.
Right?
That makes sense.
Nursing students do it all the time. Medical students do it all the time, where they have to present certain case studies. And they do that following those specific protocols, and that's essentially how it works.
Okay, so that's why they go like male.
Yeah.
That's why they go male 35 had this diagnosis, and this is what we did
pretty
to treat
much.
it.
Yeah, same thing. If you ever watched one of those what do you call them? One of those medical dramas, any one of them. I'm old enough to remember.
Yeah.
Oh, yeah, that's a good show.
Yeah.
George Clooney, is that the one with George Clooney?
Yeah.
Is it Clooney? Oh,
Yeah,
Clooney's
that's
in
the
it.
Clooney one.
Oh, okay.
1990. Hold that up. I got you.
I
Go
can't
ahead.
remember the years either. But anyways,
But,
if you ever notice, whenever the paramedics are coming in and they have the person and they're all of a sudden like, oh, male, 35, approximately this many pounds, this is what happened with them, right? That's essentially the same thing. That's just using the statistical method.
Okay. So you probably seen those, but they had those their earbuds, and they'll have some.
94. ER September 1994. I was off by 2 years.
Oh, 94. They're like earbuds, and they have somebody in Japan, and they'll say something, and they'll go like, I understood you. And then they'll say something and the thing has a little speaker on it and it'll repeat what they said.
yeah.
He's talking about machine interpreters.
Yeah.
Machine interpreters.
That is close, but that's closed loop. That's not a different type of AI. It's like, or is it connected Wi-Fi or
same AI?
It's the same AI.
Yeah, same AI. There's not. It's not any different. But
So
what it does is different though. So what it does is it takes spoken word, right?
Yeah.
It converts it to text. Then it translates that text and produces words.
Yeah. Okay.
That's
I get
essentially
you.
what it does. The majority of those work that same way. So yeah. So it's just like we'll use the three of us as an example. I'll put Richard in the middle. He's the medium, right? I say something, Richard. I'm going to name the app Richard now, right? So Richard, the app will take what I'm saying, convert it to text, translate the text, and then spit out words so that Eric could understand it.
Which is called consecutive interpretation.
Yeah, I'm aware of that. No, I thought maybe that might be a different AI, or if it was just contained within the device itself.
Nope. Same AI. Taps into the same stuff.
Okay.
So my question in that same line of thought, if hypothetically speaking, hold on, let me check my audio.
Use one of those machines.
Go ahead. If I say it, I'm gonna get pissed. Go ahead. Go ask.
Go ahead. Let's do it.
No, I'm just saying, hypothetically, if somebody went in there and had one of those translators
in the
hospital, and we're using it as their job, they say they're a translator, but they have a machine that does the translating for them.
Mm-hmm.
And then somebody shows up without the machine and can do it without it.
So you mean a real interpreter?
Yeah, real interpreter. No, real interpreter shows up.
Is that a violation?
Yeah, is that a violation? Yeah.
Yeah. The answer is yes.
Okay, I was just curious. That may or may not happen to somebody that I know.
No, I know. Yeah, dead giveaway over there, Brood. You don't have a good poker face.
I called him. So,
you called him after that? Okay.
Oh yeah.
I'll tell the story.
Yeah.
I'll tell the story.
So put it this way. I'll tell you this. Even in healthcare. Okay, so I've one of the things a lot of people may not know. I don't know if they do or not. But one of the things that I do is that I do consulting, right? And mostly I do it in healthcare. I mostly do consulting for healthcare institutions. They hire me, I go in and I explain to them essentially what language access is, how let's see, I kind of examine all the ways that they're doing it, that, according to what their plans are as far as language access. I help them I help them improve their throughput and everything else. That's one of the things that I do. And 99% of the time that I'm there, I explain to them, if you're using processes that are outside of your language access plan, like if you're using Google Translate, if you're using Copilot, if you're using Claude, if you're using ChatGPT, if you're using all these other AI tools as kind of as a way to circumvent using, whether it's a remote interpreter or an in-person interpreter, if you're doing that, then you are essentially, in a nutshell, it's a HIPAA violation, right? Because of the very essence of what AI is. It's meant to be accessible by everybody, right? So there's no specific terms and conditions. There's no what's referred to in terms of my credential in privacy and security, or HIPAA privacy and security expertise. There's no business associate agreement or anything else that says ChatGPT, all the other things that I just mentioned, that they couldn't use the information for reproduction, for storage, for sale, for because it's open source, for anyone else to use it.
Okay, so open source. There's no copyright, no
Nope.
legitimate
Nothing.
reason to think that there's any type of privacy attached to it.
Nope. None whatsoever.
Okay,
That's
all
why
right.
it's
I
such a
don't know
good
if a lot
thing.
of people know that or not, because I didn't know. I thought AI was a
You're essentially relying on the security of whoever owns the AI. Essentially, that's
China.
what it is.
Russia, Colombia.
So that's essentially what it is, right? That's what you're relying on.
So in that context and in that same line of thought process and questions, what does the process look like when someone violates HIPAA? Like if I catch someone doing that, what does that process look like for me to report that person? Or obviously, you know, my first thought process is education, which, as you taught me, like, hey, educate the client. Hey, that's not good.
Right.
You need to stop that because XYZ. Say they don't, they just say, you know, fuck you, Richard, you know, you whatever, this and that. I'm not going to do that. What would the process look like to do that?
Well, if they tell you to, to fuck off, then sweep the leg, take the back.
You know the routine, you know.
Time to sweep the leg, Johnny. No.
Yep. Once you take your back, you're like, say it again. Say it again.
Yeah, pretty much. Just give them a little room to, just to talk, and then just go ahead and apply.
Anywho.
So after you do that, you contact the authorities, right?
So there's two. This is a tale of two contexts, right? So let's just say I'm a staff interpreter. I work at let's say a hospital, just because it's easier to explain it that way. I'm a staff interpreter. I work at a hospital. I see a doctor completely just violating all of our language access policies, and they're using Claude or whatever it is on their phone, right? So I can educate the doctor and tell him, hey, doc, you're not really supposed to be doing that. That's why we're here, et cetera, et cetera. Use the phone. Oh, sorry, not the phone per se, but use the mechanisms that we have in place to do that, right? That's essentially what it is.
Okay.
Yeah.
Okay, but aside from that, okay, there are mechanisms in healthcare systems to actually report violations or potential violations. It usually involves risk. They usually use some sort of other reporting tool. There's all sorts of apps. I'm not even going to go into their names or anything like that, but there's different software that they use for reporting stuff like that. And so that's generally how it would work, right? As a staff interpreter, I could also bring it to the attention of my supervisor. They'll bring it up to whoever it is that they're supposed to bring it up to. So it leaves a trail, right? As to whom, what, where, when, why, and so on and so forth, right? Eventually, it'll filter down. Whoever the head of that department is will eventually have a chat with that person, and you hope that there's corrective action that takes place, and then that's it. What's done is done. However, if this is a pattern of behavior, then that could actually be reported to specifically, it would actually be to Health and Human Services.
Oh, okay.
Oh,
I didn't know that.
We're going to talk to RFK. So what were you saying?
Kind of. Not necessarily him. And truth be told, I'm not, not to get super political or anything like that, but I highly doubt right now that there's any teeth to the Civil Rights Division or to or to the departments that would normally handle that kind of stuff.
Mm-hmm. Does this? I'm trying to remember.
But anyways, that's just the staff side, right? If I'm an independent contractor, right, and I see a violation, I can actually go online and file one myself.
Oh, okay.
If I so choose to.
And that's after you sweep the leg.
And that's after you sweep the leg, after you do a little ground and pound, then you take the back.
Okay.
Does this include? I'm trying to remember the name because I had to do this, and I can talk about this. what was the it was CH something. It's the oh my God, we had an investigation about this. It's the people who you report. I'm sorry that I'm failing you right now, not remembering. It's the people that you report that goes to HHS, where basically it's like the hospital doesn't want that to happen because it affects their federal funding and it gets investigated. The what's it called? The oh my God, I had to.
Are you talking about Are you talking about human resources or?
A lot of people don't know what this is, and this is why I wanna bring this up because I wanna share this. It's it's CHP something. It's basically the people who basically like investigate when hospitals are doing stuff wrong. And remember, I had a situation up in the north side here where an interpreter was told someone that, oh no, you can take these two medications together without a yogurt, without water, and I had to contact. Oh my God, this is eluding me. This is part of like training. It's like it's like the people who investigate the hospitals that goes directly to HHS that they have to investigate these. It's when there's like a violation of the hospital policies and stuff like that in federal law.
How about the Office for Civil Rights?
No. It's yeah.
I don't know what you're talking about. Let's just see.
You're not gonna know because I never told you about this story. Gustavo, it's the remember when I
Inspector
had
General?
No. It's
Attorney General?
No. It's part of the hospital. It's part of HHS. This is like the place that you put a complaint whenever the hospital is violating something. It's CHPS something. God, it's basically where hospitals get graded. It affects.
Oh, you're talking about HCAPS?
HCAPS, thank you.
HCAPS.
Okay.
Talk about
HCAPS.
So yeah. Oh yeah.
Thank
So
you,
that would be.
I
Okay,
want to
so
clip this because this is really important, and most interpreters don't know about HCAPS.
okay, so
Could you explain what it stands for?
There's
please?
all right. So I know where I think I know where you're going with it, right?
Mhm.
So let me explain HCAPS just really quick. So HCAPS, okay, long abbreviation, right? Hospital Consumer Assessment of Healthcare Providers and Systems. Okay, that's what HCAPS is. All right, and so HCAPS is actually something. It's a reporting tool that the Centers for Medicaid and Medicare track. Okay.
Yes.
Yeah. So
Okay.
if you're talking
Right
about, that's the one. That's the one. Yes, sir. So, and this is actually something that patients report. Okay. So, let's just say, and then I recently been in the hospital, so I got one of these surveys myself, right? But if you have a hospital stay, if you were in the emergency room, doctors' offices are now including this as well, believe it or not. So if you haven't gotten one during a primary care visit, it's kind of surprising, but you probably will at some point. And the long and short of it is that this survey that you receive has a series of questions specifically used to measure your satisfaction, your perception of the services that are being offered to you. Okay. Long and short of it is that, low HCAP scores equal less reimbursement. Long and short of it, right?
Okay, that determines directly your federal funding then.
Yeah, it does. It can affect it negatively. And the reason why is because, so this is the minimum bar for hospital organizations, right? And the HCAPS is a way to make sure that you're actually meeting this minimum bar. If you're not meeting this minimum bar, then, hey, what's going on here? Essentially, and like that could, again, that's essentially how it could affect, long and short of it, the funding.
Can you
so it's a report card basically.
Okay, pretty much is what it is. It's because it's public. It's public knowledge. So you're actually able to see what different organizations HCAP scores are, and you can see it by category too. So So if they're not keeping the hospital clean, you'll be able to see that. If they're not communicating to you effectively, you can see that. If they're not if the hospital's not clean, if they're not communicating to you effectively or in a way that makes sense to you, okay? If
Uh-huh.
they're there's a third column. There's two more columns, but those are kind of escaping me right now.
Treatment. Patient treatment.
Aftercare, probably.
Aftercare is one of them. There you go. That's the one. That's all those things. If they're not meeting all of the minimum benchmarks, then you can report all that. That's all reported in the survey. Now, what you're referring to earlier about reporting them. So the way this works is, if in that specific scenario about bad practice, right, or malpractice in a sense, you could report it to CMS. You could report it to the county office.
Okay.
Sorry, you could report it to the county Department of Health. You could report it to the state board for licensing physicians. If it specifically has to do with someone's civil rights being violated, then you can report it directly to the Office for Civil Rights, which is a division of Health and Human Services.
Okay.
That falls under Title VI then?
Some of them do, not all of them.
Okay.
Now you do classes for all this.
Yep, I do.
Can you elaborate on those classes a bit? And
because it's not just Spanish either. It's actually okay.
Yeah, no, we do this. Well, I do some training in Spanish specific when it comes to HIPAA, but not generally. Most of the classes that I teach on HIPAA and all those and all that it's entailed are language neutral, so it's accessible to everybody.
Okay, I was just wondering because part of it is transinterpreting. Is just to be clear that not everything is for interpreting. This is for different classes for like I think Richard does one for like search and seizure and stuff like that. So it's not necessarily directly related to translating.
Correct. That's absolutely right. So, for example, I have a whole series of HIPAA classes, right? And in that, we go into basics. We go into essentially, you could equate it to basics, intermediate level knowledge of HIPAA, and then we can start getting into business, the business side of things, the compliance part. We do all of that.
Okay, and you get a certificate for this after these classes, right?
Yeah, you get a certificate of completion, and then assuming you pass the exam, because we actually do a post class assessment on it. Then you get your certificate of HIPAA compliance.
Okay, and are these state specific when you do these, or not?
I do go into state specific questions. I do go into state specific scenarios because, for example, what is perfectly okay in one state might not, and really what it has to do with is what the state's infrastructure is as far as what they classify as public records, what their state infrastructure looks like, and so on and so forth. So, for example, one of the things that I bring up specifically in a few of those classes is the state of Texas. So, if are you either you guys familiar with Kaiser?
I am not. No.
Okay, so Kaiser is Kaiser, right? They're supposedly a one-stop shop for all of your needs, right?
Okay.
As far as your healthcare is concerned, right? That's essentially what it is, right? They have urgent cares, they have pharmacies, they have specialties, they have everything in house, right?
It's a hospital.
Yeah, Kaiser. Yeah,
kind of like Mercy.
Okay, so
Mercy and Cox.
Yeah, so it's in Texas though.
Right, but no, it's not specifically in Texas.
Oh, okay.
Kaiser's everywhere. Kaiser's in all 50 states, as far as I know. But I use Kaiser specifically as an analogy for Texas. So in the state of Texas, your medical record is portable, and so are all your records.
Okay.
So, for example, if I am in Galveston, right? If I live in Galveston and all of a sudden I move from Galveston to, Lubbock, Amarillo, or any state closer towards the Panhandle, okay, right?
Uh-huh.
My medical record will follow me, and that's something unique about Texas healthcare system.
Oh, okay.
And there's less, in a sense, less red tape for my medical records to travel with me.
Okay. That makes sense.
You should
Yeah.
talk to VA.
Think of
You
it
don't-
that way.
Yeah,
Sorry,
don't
I
do
could have
that.
probably used
No,
the,
sorry.
Yeah.
I'm sorry, I didn't mean to speak.
and that's where the analogy of Kaiser comes into play, because essentially, if I'm a Kaiser patient in California, if I'm somewhere else in the country and I have to go visit their ER, they should, in theory, be able to pull up my medical records from anywhere.
Okay, very, very useful, actually. Yeah.
Unlike
So
VA
that's one of the differences between Texas and all the rest of the 49 states.
Okay, so you'll go there and they won't ask you. It's like, do you have your medical record with you?
No, they could search. They have specific infrastructure where you can actually provide your medical record number. And
Okay.
they can actually get your information that much quicker. It doesn't require specific, in a sense, it doesn't require a big song and dance for them to be able to access my records.
How come other states don't follow suit on
that? Truth be told, I don't know.
Okay, no, that's fine.
They most of the time the answer is they don't have that kind of infrastructure. They're not set up that way.
Fair enough.
Okay.
Fair enough. Part of the reason why I also wanted to talk to you about was, obviously we have a huge issue in the interpreting community.
Well, we have lots of issues, but yeah.
I'd like to talk about that. Specifically, I'd like to start with the issue of ethical boundaries, in the sense of, for the people that don't know, interpreters are like and you told this joke to me when I went through the medical courses. We're like the Swiss. We would take your money, but we don't want to be involved. Like, we know that ISIS is doing that over there. We know that this person's doing this over there. We know that China's doing this. We're here neutral. Mm-hmm. What is happening in today's world, where we have high level interpreters that just they look at ethics classes and they go, fuck this, and they just throw them right out of the window?
Yeah, there's been a lot of that happening as of late, and this is across a lot of sectors. It's not unique to court. It happens in the courts too. It happens in legal interpreting. It's not just medical.
Wow. Okay.
It's not just immigration. I know of a couple of instances of this happening in the educational field too, but those are kind of unique. It's a little unique. It's a little unique though. Okay. In the sense that
educational interpreting.
Well, okay. So the couple of scenarios we're talking about, I'll explain what happened there. It's a little bit different in education, because in education, most interpreters are hired directly by the school district, right? So they're staff, right?
Okay.
And so on top of being interpreters, generally speaking, most of them have second and they have additional roles.
Okay.
Yeah. So then they have to abide by whatever the district policies are when it comes to, well, pretty much everything, right? So in the couple of scenarios that I know of, there were some staff interpreters who happened to have been in the situation where ICE was trying to enter, and this is a specific ICE situation, where they were trying to enter the campus, right?
Immigration Customs Enforcement, for the people that don't know what we're talking about.
Okay, right. And so, again, they're not just interpreters, and I hate using the word just, but this is the easiest way people understand it, right? Yeah, they're not just interpreters. They have other roles, and they happen to be interpreters as well. So they have to abide by district policies. You know what I mean? So
Yeah.
then at that point, yeah, I mean, they're, whatever advocacy they have to do is what they have to do, but that's because they're mandated by the school district because they have an additional role. They're not strictly interpreters. You know what I mean? So
Well,
that's a little bit different. Okay.
Okay.
Same thing if I'm a staff interpreter and I'm at a hospital and ICE is trying to enter the premise. The hospitals have had to adopt new policies when it comes to that too. What information they can give out, if any, things of that nature. Okay, but what I find a little troublesome goes past is beyond what staff interpreters are. It goes past staff interpreters, where we've been having. I'm not going to say a big issue because it's kind of an individual. It's kind of it's a I guess you could say it's an individual problem if more so than anything. Is specifically autonomous, in other words, independent interpreters or independent contractors. Behaving as as activists, essentially, right? And that sometimes it can be, if not done right, specifically, it leaves a stain on the industry, and that's kind of one of the issues that we're having right now as far as industry.
A stain in what sense? Like it
So-
damages our book or our roles, or
Essentially, okay, depending on what, I hate to kind of I try not to commingle business talk with other things, but this is the easiest way for me to explain it in my brain. Depending on your geographical area, your market, right? Some interpreters either have a really good reputation, okay, generally, or they have a very poor reputation.
Okay.
The areas where there's already a poor reputation could be because of poor interpreters. They just weren't ready. They weren't prepared. They did a really bad job, or it's another. Sorry, or it's something else. As in, administratively, they just don't have a favorable view of interpreters. They think they're unnecessary. Okay. Unfortunately, that still exists now. Okay, where interpreters are looked at like, yeah, you're not really necessary.
Okay.
We could get by with whatever it is that we're using, right?
we can let the family member do it.
We can
Yeah,
use the family member, even though it's a clear right, even though it's a clear violation of due process or their civil rights and so on and so forth, right? So in areas where, again, disfavorable view of interpreters for whatever reason, okay, whatever reason it is, when you get what we're oftentimes referring to as the activist interpreter, again, this is why I like that you asked what advocacy is, right? It's action taken to support or for a specific means or to promote something specifically, right? So in this case, activist interpreters are viewing themselves as advocates and kind of getting in the way, interfering, intervening where they're not really supposed to be. Okay.
Mhm.
And then specifically in areas that is not where they're supposed to be doing it in.
Okay.
Especially in a
Well-
legal setting where you do not have any role of advocacy,
Right.
even in your code of ethics.
Well, I had a question about that because if you have, hypothetically, if people go to a college campus, ICE goes to a college campus,
Right.
and it gets federal funding, so that's public access.
Right.
But if they go to a hospital, that's privately owned. That's not public access. So what do
Certain
you do?
certain areas of a hospital are publicly accessible.
Okay.
Okay. And the reason why is because it's commingled with public, essentially with the public service. Same as
So like the emergency room or
fire,
something
police. Yeah, so same as EMS
Okay.
or first responders, right?
Okay.
They provide a public service. So like the emergency room generally is used and it kind of gets treated as a public as a vehicle of public service.
like. Okay.
Now, and that's for most hospitals, especially if they're nonprofits. If they're for-profit hospitals, then they're completely private and they can shut the door to whoever they want.
Okay, because the college technically
Right.
can't do that because if they, especially if they get federal funding, they can't do that. Now, if they're Harvard, and well, I guess Harvard gets funding too. Anyway, if there was an actual college that didn't take any federal funding at all and it was private, then the rules would change, would they not?
Right. Exactly.
Depending on the search warrant.
And that's the other thing
Okay,
too.
yeah, that's true. The search warrant, yeah.
You got this. I go ahead.
No, you're right. Go ahead, brother.
Depending,
You know more about that than I do.
What people don't understand is that when you have a search warrant or a bench warrant, right, or an order of removal, there are certain systems in place that if you intervene, which you shouldn't, right? However you feel about it, because this is the thing that we tell people all the time. However you feel about something, if you feel that it's not right, then switch fields or go advocate. I'm all for that. And listen, I am not saying that immigration, that ICE is perfect or HSI or any other agency is perfect. God knows that I know for a fact that a lot of these agencies are fuck ups, right? Or let me rephrase that. A lot of the people who work in these agencies are fuck ups. I know that better than 99% of the interpreters. However, it has always been said that if you feel a certain way about something, then just switch the field. That's the beauty of having legal, medical, and educational now. The problem that we have is that we have people that have taken a conscious stance and first of all, if you violate your vow of neutrality, okay, you are no longer acting in a capacity in which you can serve that role.
You're no longer an advocate.
You are no longer an interpreter because you have violated a vow of neutrality. And I'm all for that. If you feel a certain way about certain things, whether it's political, whether it's social, whether it is private, that's fine. That's the beauty of being where we live. But the problem that we have is we have individuals that want to interject how they feel about something when they don't even understand how the fuck a system works. Whether that is because you think you know how it works because of what you read on the news.
Well, I watch Law and Order, so
whether that's part of because of what you think you see on the TV. Most people don't understand the intricacies of how much fucking paperwork it goes into. I'm not saying that people don't fuck up and shady things and fucked up things happen. What I am saying is people need to understand, and this is the advice that my dad gave me years ago. The moment that something starts to feel personal, just let it be. It's one of the main reasons, as you know, it's one of the main reasons I don't work human trafficking cases anymore.
Yeah.
Is because I started to have a moment where it started to get personal.
Yeah.
And that's the moment you need to remove yourself. The problem we have is we go through all this training, through all this wealth of knowledge that we have.
Mm-hmm.
And instead of being like, you know what, I just don't want to do this anymore. I'm going to go ahead and be an advocate. And I'm going to go ahead and do this. That's fine. You can do that. But the problem is when you start interjecting unprofessionally also, might I add, oh, F this person or this person's a whatever sucker, or this person doesn't know what they're talking about when you don't even know what you're talking about. Because if you cannot explain to me why it is that you feel about that way, other than, well, this is how I feel, then you are emotionally compromised.
So I'm just saying, just because the other person's screwing up doesn't give you a right to screw up too.
No, because you have taken a vow of neutrality. And I don't understand how some people don't get that, because at least when we do training, right? That's the number one thing that I tell people in and we keep transcripts of every freaking class we have. Hey,
yeah.
The moment you start to feel one way about something, maybe you should sit down and have a conversation with yourself. Because the problem is that, and this goes back to what the boss man was saying, is You can't interject your personal feelings and or your own agenda, however you want to describe it. Whether, oh, well, this is wrong. Well, explain to me how it's wrong.
Yeah.
Because if we want to talk about right or wrong, there's a million things that we can talk about that's right or wrong that people don't care about.
Well, there's also another thing. Is this against the law or not? It doesn't necessarily mean it's right or wrong.
So then
I'm just saying when you said,
hold on, I got you.
Okay.
Explain to me how XYZ things are wrong. How do you know that something's wrong? How do you know that the person coming in is doing it wrong? Because they're not gonna. Let me show you something. If I come into a house with a search warrant, right? To give an example, if I come into a house search warrant, I'm knocking and announcing myself.
Yeah.
How do you know that I'm doing it right or wrong? When that person doesn't know what a search warrant looks like, that they don't know.
My whole thing is just because it feels right or wrong,
correct,
doesn't mean it's against the law.
No, because it's a feeling.
Exactly. That's what I was trying to get at. Because this is it's like this feels wrong. Yeah, but it's the law.
Yeah, but it's the law. If you don't like that, then go be a politician.
Yeah.
If you don't like that, then go change it.
Yeah.
Don't come into a profession, and I take this wholeheartedly because I have worked with HSI before. I've worked with the DEA before.
Mm-hmm.
I've worked with ATF. I've done some work with the FBI.
Yeah, I've seen the FBI on TV.
And I know the amount of work that goes into a lot of things.
Mm-hmm.
I'm not saying that certain things that happen are right or wrong. But what I am saying is that don't come shit on my profession that I've spent over 20 years working on because you feel one way, whether it's political, whether it's social, whether it's personally.
Yeah.
And then what happens is when I go in or when my boss goes in and we're doing the right fucking thing, they shit on us because it
feels wrong.
Apples.
Oh yeah, that could happen
too. The problem
yeah.
that I think we're having is it's not one or two bad apples; it's a couple thousand bad apples.
Well, right now it is, yeah.
And my problem with that is go the fuck away.
Yeah.
I love you, I respect you, and if you feel a certain way, you should fucking feel that way if you feel strongly about something, right?
Yeah. If you're passionate,
But don't come into my fucking profession and shit on it, and then fuck me when I gotta go somewhere, and then people want to attach what that person or these people or those people did to what I do. Right. And that's not the case, because I can tell you right now, there's conversations that you and I have that you're like, oh, I didn't know you felt about that, right?
Yeah.
And it's like, yeah, I feel about that. But that doesn't mean that I'm gonna take my shit into work, because again, like we said at the beginning, we are here to be like the Swiss.
Yeah.
Okay.
You know, that's my
let's
problem.
Put it this way. So let's put it this way. You know how in those fields specifically of interpreting, right, language access, where advocacy is a tenant, right? It's something that is within the wheelhouse, right, of the interpreter. Even then, it explicitly says that there's a time and a place and a right and a wrong way to do it, right?
Yeah.
So in a nutshell, just as Richard was saying, is that interjecting your feelings, your perception, your what's another adjective for it? Your conviction, right?
Your conviction.
Yeah, your conviction into what's supposed to be a neutral, not necessarily a setting, what's supposed to be a neutral action on your part, it goes against your ethics in general, okay? Just generally speaking. So for example, it happens in healthcare. Okay. I know healthcare, I keep giving healthcare examples because that's where I primarily interpret. But I do other stuff too, as well as in interpreting. But none of those actually require me to be an advocate. Okay, healthcare is the only one that I do specifically that does have that flexibility. So let's just say, for example, not that I am, but if I were Jehovah's Witness, right? I feel some sort of way because my religion tells me to, right?
Yeah.
About blood products, blood transfusions, about a lot of things, right?
Yeah.
Okay. Now, I'm an interpreter, I'm supposed to be Switzerland, right? I'm supposed to be a neutral party. I'm literally there to facilitate communication. But I feel some certain way about someone getting a blood transfusion because it's against my religion. If I start interjecting my perspective, my viewpoint based on my religion, and interpret negatively, okay, everything that goes into a blood transfusion, right, to try to discourage someone from getting a blood transfusion,
Mhm.
and I'm not interpreting faithfully, okay, then that's a no-no. Okay, that's actually not just a no-no, that's a big negatory. You just crossed the line. Now you're not even, now you're not even interpreting. Put it that way.
Mhm.
Okay. So
And
along those,
the same applies to any other setting, right?
okay. But along those lines, how are you recruiting new interpreters?
Ooh.
How am I recruiting new interpreters?
Well,
How do we get? How do
I mean,
we
because if
replace-
you have a loss, you're going to have to recoup your loss somehow.
Okay, yeah.
Uh,
So I'll tell you. Okay, so there's a scary statistic out there that approximately, and this is an approximation. It's not even an official inquiry. It's not an official research. It's not official research or a white paper that's being drafted. This is literally just kind of like a poll that's floating around.
Okay.
And so I don't quite 100% trust the information in it, but I know who's published it and I know who's managing it. So and I do have faith in them.
Okay.
But it's kind of a public poll, so just about anyone could be participating in it. But the long and short, this poll that's in existence, essentially is estimating that about 30% of interpreters are going to exit the field.
That's quite
And
a
it
bit.
could be, yeah, exactly. So, and it could be because of retirement. It could just be because of the hyperpolarization of politics right now.
Okay.
It could be because they feel some sort of way, whether it's positive or negative, mostly negative, about about what's happening in different industries, just across the board. It doesn't matter what industry, it's just in general. Okay.
Okay.
And so and to your question about how do you recruit more interpreters, how do you recover that? Because there's going to be a mass exodus, essentially, right?
Yeah.
There's a group of students that I went and talked to a couple of weeks ago. I know their professor. Shout out to Victor Cisneros over at Moreno Valley College.
Oh, okay.
They have a certificate program. They have an associate's program over there too, which is really cool. Okay, but anyways, I was talking to the students, and they had questions about AI. They had questions about recruitment. They had questions about politics. All great questions. And the way I explained them to them is that, look, right now you're in the best spot possible, especially if you're just getting into the profession, because you can actually grow when it comes to AI specifically. You can actually grow with AI. You can actually see the progression in how safety rails are put in. You can be part of the discussion in regards to safe use of AI, specifically in our fields. That's one of the things they can do, and they could be they're a lot more equipped than not. I'm a little bit of a titi when it comes to technology, to be honest with you. I can adapt, but I'm not the quickest when it comes to it. But they'll be able to actually grow with it, shape it, and play ball with it better than what I can. Okay. And when it comes to getting into the field and becoming professional interpreters, well, they'll be replacing the ones who are leaving, and they're coming into a low, unfortunately. But that just means that once we get past this hump, once we get past this low, things are going to grow for them exponentially.
Yeah, I can see that. That's the same thing they were saying about trade jobs. Like they did a survey, said they would lose like 30% of carpenters within the next 5 years because of retirement and
Yeah, exactly.
whatever reason they're losing, and they need to replace those that are coming out within the
Right.
next. So the trade schools are trying to recruit in high schools more than they used to get people into the trade schools. And I didn't know if the translation was also trying to do that as well.
We should be doing it, to be honest with you, but I don't see a lot of people doing it. Okay. And that's actually one of the differences between, I'll say this, transinterpreting, Opti, from other organizations. Okay. We actually do go into, or at least we try to. We're not always, we're often, sometimes, believe it or not, we're actually met with a lot of resistance.
Oh, really?
Yeah. For whatever reason. There's a number of reasons why, truthfully. For some people, they don't view it exactly as we sometimes get lumped with trades, but we don't get the same warm reception as trades.
Now, you don't have to interpret just for Spanish. You can do like German, French, any other language as well, right?
It doesn't. Oh, yeah. No, it does. Yeah.
So it's not Spanish specific for translating.
No, not at all. No. Oh my God. The interpreting and translation field has room for everyone. And if you have what they refer to as rare languages, or sorry, if you interpret into a rare language, or in industry talk, and like a language of lesser diffusion, then dude, your market, while very specific, means that there's less competition.
Yeah, I only reason I brought that up because they had a guy who he could speak and translate. Well, he could speak and read. I don't know if he translated, but he could speak and read Arabic.
Yeah.
And they tried like hell to keep him in. He was in the Navy, and they were trying like, hey, we'll do this, we'll guarantee this. They were doing all this stuff to keep him. But apparently the private sector was a lot more lucrative. He got out. But I'm really just saying, yeah, but he wasn't actually a licensed interpreter. He just read and spoke Arabic. And companies were like, hey, can you interpret for us? So they would have trained him on how to be an interpreter and paid him.
Yeah, exactly.
So my question is, we've been talking for a while about this, and we're wrapping it up here. What are some things that interpreters that are staying in the field and interpreters that are coming in the field should do to be able to continue to grow and stay in this field that's, gigantic? Because it can be overwhelming for some people.
It's huge. So one of the things specifically, and this is something that was a commonality amongst all of the presentations and the conversations at the conference, is that diversification is key. Okay. Like, for example, I started off as a medical interpreter specifically. Now I do education. Now I do finance. I interpret in construction sites now too. I've expanded into, I expanded into consulting specifically, although specifically for healthcare organizations. I also do it for general businesses who are looking to expand their services for their LEP employees. I'm still under NDA, so I can't really say who it is or the particular client's name, but they are in refrigeration. Okay, 60% of their employees are limited English proficients. They just happen to be Spanish speakers. That's my forte. That's my language, right? Of interpretation and translation. So I translated their HR manuals into Spanish. Okay. I've gone and I interpreted for their open enrollments, for their new hires, safety classes, in other words, their OSHA classes, other specific training, new product launches so that they understand them, everything, right? One of the things that I sometimes get pushback on from other industries or within that same industry, but just in general, is that like, well, for safety reasons, we want everyone to speak English, and that's a legitimate point, right? For safety reasons, right?
Yeah, that
But
is legitimate. Yeah.
yeah, it is, and that's fine. But who are the ones? But and this is what I keep telling people, and this is something that's best practices. You could go onto any HR um, website. Could be like SHRM, for example. You can go onto to HR. I forget the name of the other website, but these are well-known HR management websites. You can go into any and all of them, and they'll tell you like, well, if you're only citing safety concerns, but most of your staff is Spanish speaking, then the safety argument kind of goes out the window because they're all able to communicate amongst each other any safety concerns, and they can actually report that to their immediate supervisor, who then reports that up the chain of command if there's any sort of safety concerns, right? So that kind of
Yeah.
becomes null. Okay.
Well,
So then it comes down to essential functions.
Yeah.
And if in their essential functions, knowing English is not one of the essential functions, then you can't use that argument that, we have to have them learn English because of X, Y, or Z. Okay, is it part of their essential functions? If the answer is no, then you can't use that. Whether it's for hiring purposes, promotion, or whatever it is.
Well, the reason I bring that up because I used to live in Puerto Rico, and I was working on a helicopter, and I was inside, working on the helicopter inside, and there's somebody on top, and the guy came out and asked him if it was okay to put power on the aircraft. Didn't know I was inside, but they did it in Spanish, so I didn't know the Spanish word for power. So when they put power on the aircraft, and I'm inside working on it, I saw God for a second, and then it was a bright light. I don't know if it was God, but anyway, in that particular situation, it was base wide. It's like speak English at work. Because I don't know if it would have killed me, but it did hurt a lot.
DOT,
yeah.
DOT the same way.
So
DOT expects that too.
So I'm just saying, I understand whenever somebody says you need to speak English because, I had a very electrifying moment that I didn't want to have.
Oh yeah, I've had those myself too. It's not fun getting shocked by a defibrillator when you're not the one experiencing.
Yeah, that wouldn't be good either. No. By the way, I understand the safety part because even though most people did speak Spanish in there, because there was a lot of Puerto Ricans in the Navy in Puerto Rico.
Than Puerto Ricans.
There were. I wasn't one of them, but and I paid the price. I tell you what. I get
that. To sum it up, first of all, thank you for doing this. I really appreciate it.
Yeah, no worries. Of course. Always happy to be on.
Yeah, can you give everybody the deets on where they can join OPTI and where they can find the upcoming courses for trans interpreting?
All right. So,
and how many classes are Richard teaching? That's what we want to know. How many is Richard teaching?
How many classes is Richard teaching? A lot.
Yeah, is he teaching?
In December. I'm off in December.
Okay,
He's
so next year.
December, unfortunately, but he'll be back in January.
Okay, all right.
We will build him better, stronger, faster. Okay, so OPTI, you can visit our website, opticonnect.org. Okay, that's the website. You can join, you can donate. One of the things that separates OPTI from a lot of organizations, because a lot of people don't know this, is that we have a big tent. Okay, we're in it for interpreters and translators across all sectors. We're not niche. We're not just medical interpreters. We're not just translators. We're not just for court interpreters, okay, or legal translators. We actually our goal is to represent all interpreters and translators across all sectors and across all industries. Okay.
Okay, and this is an organization separate from trans interpreting.
Oh yeah, this is very separate from trans interpreting.
Okay, all right.
And so one of the things that we do at OPTI is that we live by three specific pillars: educate, advocate, and connect. Okay. Where we provide education is to our membership, and of course those who aren't members, we're always doing classes for continuing education. We're also participating in podcasts like Rico Podcast. Okay. Again,
Of
like,
course,
subscribe. If you guys aren't doing it, shame on you. Okay. So for everyone who's listening, do it. Okay. Be like Nike, just do it.
Just do it. Yeah.
Okay. And the other thing that we do at Opti is that we actually work with the lobbyist full time. I know a lot of people might get turned off by that, and they're like, "Ooh, lobbying, that's a dirty word." But truth be told, a lot of people understand that is how shit gets done. You know what I mean?
That's true.
You have to work with a lobbyist. You have to work with someone who knows the ins and outs of your. If you're working on the state level, of course, which we do, Apti in California, although we're looking to replicate all of our successes in other states as well. But we have to work with someone who knows the ins and outs of the assembly, of the legislature, who knows, who has connections and can give you or facilitate you getting a political capital. You know what I mean?
Yes.
And so, because that's the only way that things actually change. If you want, better work environment for interpreters, let's just say, if for those who are concerned about AI specifically taking over or taking our jobs, or whatever it is that the fear is, then if you want to put up safety rails on the use of AI, then that's the only way to really do it, is to actually approach the legislature, lobby, advocate, pass laws. That's it. That's the only way that's actually going to change. And that's really our goal at Opti, is to be a conduit for interpreters and translators to get those laws changed, to get those protections, to get that recognition. And ultimately, one of our goals is to create a state licensing board so that interpreters and translators within the state borders get the same recognition as those professionals that we serve: doctors, lawyers, therapists, and everyone else as well.
Okay, so you got lawyers. There are also lobbyists and volunteers and other people that know how the system works to try and make a positive change.
Yes, we do. We work with anyone whose vision, whose mission aligns with ours. So we are looking to work with the Bar Association. We already work with the California Judicial Council. Okay. We also,
nice.
So we already work hand in hand with them. We also work with or plan to work with specifically the union that represents the staff court interpreters, which is the California Federation of Interpreters. We're making inroads with other organizations at the national level, like National Association of Judicial Interpreters, the Association of Independent Judiciary Interpreters of California, the American Translators Association, National Board of Certification for Medical Interpreters, National Council on Interpreting in Healthcare, the American Alliance of
how many organizations are there? I mean,
dude,
you named off quite a few.
Oh, dude, there's okay, this not to sound cynical, but it's alphabet soup out there, man. There's all sorts of organizations, and a lot of our missions and a lot of our work do overlap, and that's kind of one of the things that unfortunately has been a hindrance for interpreters and translators to actually get things done. There's a lot of organizations, a lot of people support, which is great. I'm glad that people are supporting organizations, but there's little work that is done in those areas where there is overlap amongst organizations. And
So you guys don't
That's
necessarily coordinate. You don't necessarily coordinate with all the
we don't
other
necessarily coordinate with other organizations, and that's kind of a crying shame. But that's one of the things that, again, as the currently interim president, hopefully in the very near future, it becomes a done deal where I am the president of OPTI.
Nice.
But that's actually one of the things that I definitely intend to change, and specifically collaborate more with other organizations.
Okay, and you're not just in California; you're all across the United States, right?
Right. So while we are California based, we do work across state borders. So yeah.
Okay, good to know. All right.
Yeah.
Gustavo Negrete, everybody. Jefe, thank you for doing this. I sincerely appreciate this.
Yes, definitely.
And for everybody that's listening, hit the like and the subscribe button, and follow us for a lot more.
Awesome. Thanks, gentlemen.